So we know a few things. The first is that supported employment is vastly superior than any of the other interventions that we've tried, and I've studied many of them to help people achieve their vocational goals. We also know that a number of other benefits accrue to people, not by being in supported employment, but by being in jobs. And so it's really the people who become consistent workers who benefit in so many other areas of their adjustment. We also know, and I think this is an interesting point because I was very unsure of it at the beginning, you know, all of the research studies in at least in the United States go for a year or 2 years at the most because that's all we can ever get funding for. And the initial studies of supported employment showed that we were greatly successful at getting people in jobs for 5 or 6 months. But we didn't know if that really affected the trajectory of their employment or of their lives over time. And we now know that if we can get people started in work, it actually improves over time. And I'll show you some data on that. And that's a consistent finding across the long-term studies. And finally, we know that supported employment, at least compared to other mental health programs, is relatively simple and easy to implement, so that we've had great success implementing it in a variety of programs in different areas of the United States, different real-world routine mental health programs, and in fact in different programs around the world. So as this work has gone on for the last 18 years now, the model of effective services has become more and more clear. And Deborah Becker and Gary Bond have in fact just revised the supported employment fidelity scale to reflect a lot of the findings as things have evolved over that time. But it still focuses on these main features, that since people want competitive jobs, we should try to help them from the beginning to get into competitive jobs, that it's more efficient to use a team-oriented approach so that mental health professionals and vocational professionals are working together, that we should pay attention to the client. I hope client is a word that you use here in this country. I know that it varies in our country from state to state and time to time, but by client I mean patient or user of mental health services. But client choice is terribly important in terms of the timing of services and of going to work. And the client usually has a much better sense of this than professionals do. We know that most people don't understand, at least in the United States, the complex structure of their health and disability benefits, and so benefits counseling is an essential part of the model. We also know that all of the pre-vocational training that we used to do and that I was taught was terribly important when I first got into this field is probably terribly ineffective, and that starting with a rapid approach to searching for employment is much more effective. And we know that matching jobs carefully to the client's interests and skills is an important feature of the model, and that people who are in jobs that match their interests are much more satisfied and stay in the jobs much longer. And finally, we know that many people are going to require ongoing supports as they develop not just their first jobs, but try several jobs and develop careers over time. So those are the essential features of the model as it's evolved, and the details of all of these are much better worked out than they were 15 years ago, and we'd be happy to send you copies of the current fidelity scales and training manuals. Okay. The evidence base for this intervention is strong, probably stronger than anything else we do in mental health. You know, when we do medication studies, we tend to have hundreds of people in the studies because the effect size is so small that you really can easily miss it if you don't have overwhelming numbers. But that's not the case in supported employment. It's such a robust intervention that, as you can see in this slide, it's superior to everything else that it's been tested against in every country that it's been tested, with every kind of client and mental health worker where it's been tested. So there are 16 in this slide. There are now 18 randomized controlled trials looking at supported employment. It's better than all sorts of forms of psychiatric rehabilitation, clubhouse models, transitional employment programs, on and on and on, where we've had the opportunity to test it. In the modal, if you will, study, about 2/3 of the people are successful in getting into competitive jobs. The jobs usually begin a few hours a week. They typically, in the United States at least, build up to about 22 hours a week, and that's because they're limited by the health insurance trap that exists for people who are on Medicaid insurance in our country. The typical first job lasts about 5 months, and the typical client in these studies tries 2 or 3 or more jobs before they settle into a job that really becomes a long-term career. So when we just follow people for a year, it looks like they're brief jobs, and when we follow people for 10 years, it really looks like they settle into a job that they consider close to their heart, just the same that most of us do, and that is a career and part of their personal identity that they stay in for years.